Did you know you have one of the best places to work in Indiana right in your backyard? Schneck Medical Center has been given this honor on several occasions. Not only that, but Schneck is one of 102 hospitals in the U.S. to receive a national 5-star quality rating for the care provided to patients. Also, Schneck is the only Baldrige National Quality Award winner in Indiana, a presidential award for quality. If you are thinking you might want a career in healthcare, you should give Schneck a look. Nearly 1,000 people in our community work at Schneck. It takes a whole team of individuals to keep our county hospital performing at its best. Of course, there are doctors and nurses, but did you know there are facility workers, cooks, marketing, and IT positions too, just to name a few. Positions are available for people with various education levels. We'll break it down by the level of education you need and describe some of the careers you can find at Schneck. Maybe you don't want to go on to college, or you just can't decide at this point what career you want. Schneck has positions available for people who end their education with a high school diploma but want to continue to grow, develop, and build a solid career. There are positions in environmental services, patient financial services, nutrition services, and more. Let's take a look at a few.
Actually, I was 16 at the high school, and they had opening in the counselor's office, and I applied for that, so I've been here since I was 16 years old. It's fast-paced. It is very rewarding. You learn a lot of different life experiences, not just for your job here, but also to carry you through in your everyday life. A lot of life skills.
I didn't know what I wanted to do. Thinking about a career kind of made me nervous for something that I want to do for the rest of my life, and coming here opened my eyes that, you know, I might be interested in nursing, I might be interested in, you know, dietary management. There's so many things that I get to see that makes me want to, you know, further my education. And being here, I got my foot in the door. And now it's up to me to decide what I want to be a part of. And being a part of this Schneck family has been a very great, it's had a good impact on my life.
You need to look at all areas. One thing, as a high school student, if you were to volunteer at the hospital, that might be an area that you would say, I would like to volunteer in the kitchen to see if that's something I would want to do. Because there's all kinds of things in a kitchen in a hospital that you can do. You can cook, you can be a dishwasher, you can, we have a host program to where they are actually touching the patients 4 and 5 times a day. They are the eyes and ears sometimes of that patient by going in and doing menu selection. There's so many different areas. Also, the dietitians are very important to the hospital. So you might then see if you would like to be a dietitian. So there's many avenues in the food service industry for a high school student to pursue.
If you want to better yourself and better, you know, the life of someone else, that being here is a very good opportunity for that. And no matter what you do here, you're impacting someone's life, and it will touch you, it'll touch your heart, and it'll have an impact on your family and your outlook on your life period.
It's a great place to work, it really is. A lot of wonderful people. Don't be afraid to try something new. And my daughter, who is going to go to school for nursing, I always tell her, start at the bottom, work your way up. They may find out that there's something in dietetics that they like. If they don't, they can always go to nursing. There's so many opportunities. It's not just, oh, I just work in the kitchen. There's a lot you can do with that.
As a manager, we look for people to work in our department that are customer service oriented, that they would blend well with our team, have a good work ethic, and enjoy what they do.
My job at Schneck is very important because we have to strive to keep our environment as clean as possible and as germ-free as possible for not only our patients but also our visitors and our fellow coworkers. If I had to give advice to a high school student, my first thing would be to start in the medical field early. That's probably the only regret that I have, is that I didn't start in this field earlier, and then you can work your way up.
Typical day, we get here at 6 o'clock in the morning and we take care of any overnight orders or maybe IVs that we have to mix or IVs that are first thing in the morning. And then around 7 we get our order and we check that and scan it in and put it on the shelves. We have assignments. There'll be a morning technician that'll take care of all the chemos and the morning IVs, and then an afternoon technician takes care of all the afternoon IVs. That includes chemotherapy, inpatient, and outpatient, which Dr. Winley does a lot of vitamin bags that may include 6 different things. So you have to draw those all up individually and make a bag that way. And then there's a technician that does all the refills for the floor, and they do the running. And then we usually have one that's extra that can either be working on projects or helping out wherever we need it. I don't have any extra education. I was trained on the job. I do have a certification that's a CPHT, and then now we have to be licensed with the state. We always tease that it doesn't take a lot of skill, and yet it seriously does because patients' lives are involved. We have to make sure we read what we're doing, read the label, read the drug, the pharmacist checks it. So I love it because it's a lot of variety. You don't get bored because you're doing something different every day.
The people in the office that I work with make coming to work great. They all have different things that they, how we interact with one another, and I love the people. But I also love sitting at my desk and managing my own workload. I don't have anyone micromanaging me. I do have my bosses that I report to, and I have things that I need to get done, but I work at my own pace at my desk and get my work done at my own time, and I enjoy that.
If higher education is an interest for you, there are many positions available for those who earn technical or associate's degrees. Technical positions can be found in the emergency department, diagnostic imaging, diagnostic lab, respiratory care, and more.
Hi, I'm Leslie. I'm one of the special imaging technologists here at Schneck. I do ultrasound and nuclear medicine here at the hospital, and I work 4 10-hour shifts. So I come in at 7 o'clock in the morning and work until 5. Typical day, we sort of alternate in and out of ultrasound and nuclear medicine. What I like most about my job are my patients. I feel that my patients are like family. How would I want my family members to be treated? And especially doing ultrasound and nuclear medicine, we're in the same room with the patient, and we can get into all kinds of fun conversations. This is my second profession. I have a degree from Indiana State in Office Administration, and I was at my desk one day in Indianapolis and I thought, I'm bored. And what made X-ray school pop into my head, I have no idea. But with already having a degree, I had a lot of prereqs already done. I was accepted into the School of Radiologic Sciences at IUP in Indianapolis. And it was a 24-month program, a certificate. It was a degree program. I have an associate's degree from that. And before I got into it, I just volunteered a lot at different hospitals there in Indianapolis. That's where I was living at the time. And I just thought, you know what, this is a good fit for me. It got me out from being behind a desk, and it's been a good fit. And yesterday was my anniversary, and I've been here 18 years, so.
I think the number one thing as a PTA is just being flexible. So sometimes I walk into work and I might have 12 patients, and then by the end of the day I've seen 16. So it just depends. Other days you might only see 8. But from start to finish, it's 8:30 to 6 for me, and I see a range of all kinds of different patients. Treatment sessions are typically a half hour to 45 minutes, but typically the half hour. I like that it's, every day is a new day, so there's room to grow, and you learn something every day as well. So working underneath the physical therapist, they can teach you stuff on a daily basis, but you also have someone to reach out to if you're unsure of what to do from here. As of right now, the state of Indiana requires that a PTA have an associate's degree. So you do a 2-year program. 2 years prior to that, you'll do prerequisites, which take the 2 years, but then the program's only 2 years.
Of course, nursing is a big need at any hospital. There are a variety of nursing careers available at Schneck.
Back when I went to school in 1983, it was pretty much you could get a 2-year degree and be a registered nurse, an associate degree, and that was acceptable. Things have changed a lot since then. I have 2 children that are just now finishing nursing school, and it's highly recommended that you get your bachelor's, your 4-year degree. which is the big push for us. There are still some of the 2-year programs out there, and sometimes that's a good fit for folks financially if they want to do that. However, if you really want to work in a hospital, critical care, of anything of that nature, we are really encouraging all students to go on and get that bachelor's degree. Go 4 years, because you're going to have to go back anyway. We've had over 100 nurses here at Schneck within the past 2 years that have had to go back and complete their degree. A lot of different nurses here at Schneck. Doesn't mean that you're just one particular type. We have nurses that work on the inpatient units where our patients come in to have babies or have surgeries and stay. There are medical surgical nurses. We have nurses that work in our oncology center that they help give the infusions of the chemotherapy and help with radiation as well for those patients. We have operating room nurses. We have nurses that work in intensive care, nurses that work on help deliver babies. We have some in the home health department. We have some in education, which is where I'm at right now. We have numerous roles. If I listed all of them, it would probably go well into the hundreds as well. We do have advanced practice nurses as well.
Just with my experience, seeing how patients react when they first find out that they have cancer, it really interested me and kind of broke my heart, seeing how they reacted and how the uncertainty, the anxiety that they went through. How can I really help that person to go on that journey and assist them and just be there with them and provide education for them, support for them. And I found out there is a program that I could be involved in just to fill that gap for that patient. As far as my education, I do have a bachelor's degree. I went to nurses training and went 4 years. And then also I'm certified in oncology, which requires that I work at least 1,000 hours in my field. And then I took a test. And then after I've completed that test and passed it satisfactorily, every 4 years I have to have so many hours of education to maintain that certification. And I've had that certification for many, many years, and I find that's very rewarding that I continue that and keep up on my skills and education, because there's lots of new drugs coming out all the time, and there are new procedures that are being done, and so it's very important to keep up on this education. It's very important to communicate about our patients, because it involves lots of different areas. Like when I have a patient that needs assistance with finances, I rely on the social worker or a dietitian if the patient's not eating well, or they may need rehab, or the various departments in the hospital. So we all work together.
I got into the medical profession when I was 17 years old. I went on a field trip to U of L, and outside there was a helipad, and there was a helicopter sitting there, and I fell in love, and I wanted to do whatever I could do to end up on that helicopter. So when I got out of high school, I went to EMT school and became an EMT and worked as an EMT for a few years, and then I went to school to get my advanced EMT, and then I became a paramedic, and I worked in random counties throughout southern Indiana. Once I became a paramedic, I came to Jackson County and found my home here with emergency services, and then I decided to pursue a nursing career. I went to Ivy Tech. I got my associate's degree in nursing. I also have my associate's degree in paramedic science. Then Schneck encouraged us to get our bachelor's degree, so I obtained my bachelor's degree through IU online. I have worked in the emergency department. I've worked in ICU as a nurse. I flew for Lifeline for 2 years as a flight nurse. Then I became a house supervisor so I could be a resource for the entire hospital. And now I've taken on the role of critical care manager at Schneck.
When you're thinking about nursing, you'll have people ask you, what kind of nurse do you want to be? Do you know for sure? Or I kind of scratch my head when I hear over and over again, I want to be a pediatric nurse, or I want to be an OB nurse, or, you know. Honestly, when you get into nursing school, you're going to be exposed to med-surg nursing, operating room, emergency room, ICU, labor and delivery, psych nursing. They're going to expose you to numerous types of nursing, and you'll have clinicals through there, which is a really good opportunity for you to kind of get your feet wet to see, I like this, or no, I absolutely do not. So If you want to go into nursing and you're concerned that you do not know what area you want to go into yet, that's okay. There's many options, and you don't have to decide until you've passed the boards and looking for a job.
I like the diversity of it. You never have the same day twice. Everything is different every day.
Typical day. I love this question. That's the fun thing about nursing and healthcare. You never know what each day is going to provide. I love working at Schneck. I was born here. I'll be very honest with you, when I finished college, I was going to go off and take the world by the tail. Had no vision of coming back here, and I ended up back here. And it's the best thing that's ever happened to me. The quality of care that we give, the opportunities that they've allowed me to grow professionally, to learn, are phenomenal with that. I love coming to work. I love taking care of people I know. That means a very, very special thing to me. And it's nice, on the other hand, when I'm the patient, that I know the people taking care of me. So I have no regrets. I love working here.
Opportunities other than nursing are available for college graduates and advanced degree holders. Those can include positions in human resources, accounting, the pharmacy, and more.
What got me interested in nutrition and wanting to be a dietitian is I was a 10-year 4-H member. I took the Foods Project for 10 years, and there was just a lot of opportunity to learn about food and the science behind it, and I also was interested in the people and connecting with people, and I felt that a dietitian was a perfect way to combine both of my interests. A typical day in the life of a registered dietitian in a small hospital like Schneck is very varied. We spend some of our time with inpatients, which just means the patients that are here staying in the hospital, and we may do assessments to calculate the patient's calorie and protein needs. We might do education if they need to follow a certain diet before they go home. We'll provide that. We also see outpatients, which means that the patients are referred by their doctor and they will come in and do a class with us. We have diabetes classes, we have heart healthy diet classes. We also see patients who are interested in losing weight, and we'll counsel them on that. And we also have a weight loss surgery program. And with those patients, they're required to meet with a dietitian for so many months before and after surgery. So we spend quite a bit of time developing a relationship with those patients. The education requirements for a registered dietitian include a bachelor's degree, and then also completing an internship before being able to take the registration exam. There are some dietitians who also hold a master's degree, and that's not required right now, but in a few years it will be.
So since I had a love for biology and chemistry, I decided to pursue a degree at Purdue in the Doctor of Pharmacy program. And that program is a 6-year program. You start out with 2 years of pre-pharmacy and then finish up with 4 years of pharmacy school. As a clinical pharmacist here at Schneck, I interact with other physicians and nurses and other staff to ensure that our patients are on the right medications for the illnesses that they do have, as well as the right doses. Oftentimes when patients come into the hospital, they may not be breathing well, or their kidneys may not be functioning well, so we do have to adjust doses of medications.
I chose the healthcare career because I enjoy the medical aspects of things, the science, and the continually something new, evolving and learning new things continuously. As a speech therapist here at Schneck, we can see the population from birth to elderly population, ages, I think the oldest I've probably seen is 100. So we kind of see it all. I primarily specialize in swallowing disorders in the pediatric population, kids that may be on feeding tubes or having trouble learning to eat when they're babies.
I'm Courtney, and I'm an occupational therapist here at Schneck, and I work mostly with kids, but in the mornings I also go to the hospital and work in acute care. So I see a lot of individuals who have joint replacements and individuals who have had strokes or who are just in the hospital for an illness and they are weak and so they need therapy. And then in the afternoons I see kiddos, and some of them have developmental disorders like autism or Down syndrome, and I just work with them on meeting their developmental milestones. So a lot of kids need help with things such as coloring, cutting, help dressing themselves, just things that we kind of take for granted each day. I love working with people. I just love talking to people and helping people, and I think the best part of my job is just feeling like I've made a difference in someone's life.
Hi, I'm Lance. I'm a physical therapist here at Schneck. I've been working here for roughly 3 years now. My typical day consists of seeing patients. I am involved with some administrative work here within our department, but typically see patients from 7:30 to 6 every day, working with a variety of different patient types, such as orthopedic related patients, neurologic related patients, occasionally pediatrics, but typically I kind of focus more on the sports med related injuries and those types of patients. I really enjoy working with athletes. That's probably my favorite patient population to work with. I enjoy my peers that I work with. We have a really good team here, and yeah, just helping people from they come in with an injury, they're not able to do something you would like for them to do or they would like to be able to do at that time. You work with them, and by the end of it, hopefully they're able to do whatever activity it is, whether that's getting in and out of a car or playing around a golf.
Naturally, Schneck has many physicians as well. There are a wide variety of physician specialties you can pursue. You may have had interactions with your primary care or family doctor, or perhaps you've had a sports injury and have seen one of our orthopedic doctors, or maybe a specialist like an ear, nose, and throat doctor or a dermatologist. Let's meet a couple of physicians who work at Schneck of whose specialties you may not have heard.
Always wanted to be a doctor since high school, basically. I enjoyed the idea of the intersection between biology and science and interacting with people. And so that's something that medicine offers in spades, is right at that intersection. And so it's kind of what I always worked towards. I did a biology major in undergraduate, spent 4 years in undergrad, and then went to medical school, spent 4 years in medical school. Throughout that whole time, I wanted to be a family practice doctor. The kind of country doc is really the only thing that I had been exposed to, and that's what I had sold myself as. That's what I wanted to do. And when I started doing rotations in third year and actually started doing the work, I realized that I didn't necessarily have to be the old-time country doc, and I could do whatever specialty I chose. And so I started exploring options, and one that really piqued my interest was anesthesia.
When I was in high school, I really didn't know that I wanted to be a physician. And in fact, I initially went to pharmacy school at Butler University. And what I found in my experience was that there are lots of different types of medicine, and that all physicians aren't alike. Physicians are many different personalities, and so unless you investigate it, you really won't know if your personality is right and your skill set is right to be a physician. So I would encourage all of you to look at it as a potential opportunity in the future. As a hospitalist at Schneck Medical Center, I completed 12 years of training, 4 years of undergraduate college, 4 years of medical school, and 4 years of residency training. In an office practice, you oftentimes see the same patients over and over again, having an opportunity to develop long-term relationships with those patients. As a hospitalist, a lot of your relationships are short-term. So it's very important that you get to know people quickly and be able to assess their problems on a short-term basis. In an inpatient setting, patients are often more ill, require more procedures, and there are more emergencies. One of the things I like about that is it gives you an opportunity to be involved at one of the most critical points in somebody's life, and it's a very rewarding feeling to see them walk out of the hospital knowing that you had something to do with that.
Somewhere along the road, I think in undergraduate, somebody told me that that pre-med is just another name for undecided, and I wholeheartedly believe that. And kind of stepping back away from the question a little bit, I would recommend that you pursue whatever career interests you or brings you pleasure, because you're going to be doing it every day for your whole life, and it's going to be important that you at least enjoy your job most of the time. And so what is it that I wish I knew about medicine when I was in high school? The physicians that you've seen, that you've interacted with as children and as high schoolers, if you've interacted with any of them, are a small minority of the potential careers within medicine. You can be a neurosurgeon or a pediatric neurosurgeon, or my friend is a pediatric plastic surgeon, or you can do geriatric psychiatry. There's just or you could not do medicine at all and be an author. There's a large swath of career choices within medicine, and just to kind of open your eyes to that and realize that any of those things are potential is groundbreaking, I guess, for a high schooler.
If I had to go back to high school, the one thing I would change, knowing what I know now, is I would have worked more diligently on my communication skills. Learning a different language, such as Spanish or sign language, is a very critical skill to communicating with patients. And trust me, in medicine, it's all about communication.
A career in healthcare provides you with an opportunity to impact the lives of others. Schneck strives to hire only the best to work in our facilities. What does it take?
Healthcare is not for everyone. It's a demanding field. At Schneck, we're looking to hire the most qualified, service-oriented staff who share our values of integrity, compassion, accountability, vision, and excellence. Simply, we want individuals who will work hard, be on time, be kind, and most importantly, put the patient first. If you're interested in finding out more about a healthcare career, take advantage of the opportunities we have at Schneck to job shadow, volunteer, or be part of a school-to-work program.
We hope you've enjoyed learning more about healthcare-related careers at Schneck. We certainly hope as you make decisions for your future, you will consider joining Schneck's team. If you do choose another occupation, we fully support you and just hope that you will return to serve the residents of Jackson County in some way.
Schneck Medical Center offers a wide range of career opportunities that impact the lives of our community. You can make a difference every day with a career in healthcare.